Okay, so good morning, everyone. Welcome to the regional meeting. We are so happy to be here with you this morning. We hope that you all are doing well and that you're safe. And we hope that this training has been very beneficial. And we have Jeff Daniels here. So really quickly, I'm going to introduce myself. I know most of you, you know who we are. And some of you may not because you're new to FISB. So I'm going to introduce myself and I will let my colleagues do the same. My name is Patrina Winston and I work out of the San Francisco office. I'm a federal project officer and I oversee the state of California, the southern state, the southern grantees that are located in California. And next we have
Deb Oppenheim, and I am the old timer. I'm definitely not a newbie. I'm the person who has been with RHY longer than anyone, and I have the gray hairs to prove it. And as some of you know, I like to talk about how many administrations I've served under. So I will be entering in January my 11th administration. And with that, and I also work with California agencies. So next, Angelica.
Thank you. Angelica Gutierrez here. Thanks everyone for joining. I'm the newbie on the team, even though it's been 2 years. It's almost 2 years to the date that I've been with RHY, and it's been a pleasure serving the grantees that I've been able to work with, Arizona, Nevada, and the Pacific Islands, to include Hawaii, Guam, and American Samoa. And yes, just happy to be here, happy to see everybody on the screen, and yeah, welcome.
Jeff?
And Jeff, yeah.
Great. Well, thank you, Patrina, Deb, Angelica. I want to welcome you all the grantees for Region 9. Your staff is phenomenal. They're wonderful to work with. I hope you have the same working relationship that I do. I won't take too much of your time here today. I just want to let you know that this is your time. We want to hear what's on your mind. We want to build this relationships with you. And I want to thank you for your creativity and imagination during this such difficult times. I've heard so many good things about what's happening and all of the unique ways that you find to serve youth in every geographical region that you represent. So thank you for being here. This is definitely a unique format. I would imagine and be willing to guess that Deb O and her 11 administrations has never had a national training in this particular type of platform. So we're all new to this. And so hopefully it's working out. I know that we've had some complications, but for the most part, it's unique and a little different. And you all have been fantastic. You really have. And so please provide us with the feedback on how we can continue to make it better for you. Again, the ultimate goal here is that we're all working together to serve youth in the best way we can. So thank you so much. And I'll turn it back over to your federal project officers. Again, this is your time. Thank you, Patrina, Deb, and Angelica, for all you do. And thank you, grantees, just for all your hard work and dedication serving youth. So you all have a great day. I'll be on. I'm going to jump around different sessions, but I'll turn it back over to you. Thanks a lot.
Great. Thank you, Jeff.
You bet.
Okay, so as Jeff mentioned, this is new to all of us. And so we're going to work as hard as we can to hear your voices and to just make it work for us in general. So we ask that you kind of bear with us if we have some kind of technical issues. So, we really would like for this session to be more than just a listening session. We want to hear your voices, and we want you to use this, as Jeff mentioned, as an opportunity to exchange information and ideas about your FISB-funded program. So there are a few housekeeping technical functions that I'd like to remind you of. And the first is the share audio visual button. That should be a button that's located on your screen. And it's located on the right-hand side. So if you have a question or a statement that you'd like to share, please click on to the button so that we can pull you onto the screen so that we could see your face, your wonderful face, and hear your voice. Because usually that's how these federal sessions are ran. If many of you've probably attended some in the past, the national trainings, and this piece of the training is where we really get to exchange information. So we don't want to take that away from you. Let's see. We will also use, as Angelica mentioned during the beginning of this call, when people were coming in, that there is a chat function. So if you don't wish to speak on the camera, you can put in your question into the chat, and we will monitor the chat, and we will be certain to answer any question that you have at the end of the agenda item, that topic. Okay, so with that said, we're going to move forward, and we're going to start with Angelica. And we can't hear you, Angelica.
Great. So there we go. So for the introductions, what I mentioned earlier, some of you probably didn't hear this, you came in a little bit after. Please make sure that you're using the chat function to include the name of your agency as well as state. And that is how we're doing the roll call. When we're in person, everybody, gets a turn to stand up and say something. Because of this virtual platform, it makes it a bit cumbersome to go through the amount of people that we have. So please make sure that you're utilizing that chat function. And like Katrina mentioned, if you do have anything to share throughout the session, you'll be able to request to share your screen at that point. But in terms of introductions, please make sure that you're utilizing that chat and that you're scrolling through that to see who's on. You can also see folks' names towards the top right-hand corner. If you click on people, you'll be able to see who is on the session. Okay, so I'll turn it over to you, Deb.
Okay, the agenda for today, and I think it's not too ambitious. We expect to get through it. We're going to start with COVID-19. Then we'll go to RHY, then the supplements, the carryovers, and no-cost extensions on the CARES Act. Then we're going to talk about the virtual site monitoring visits, which will be coming up. Then just a little bit of discussion of the federal update from yesterday for those who either missed it or weren't able to take notes, really important things. And then we're going to talk about reactions to this virtual training, how you feel about it. Obviously, we get to have more people involved, but we don't get to see each other in person. So, but we want to know about how you have responded to getting questions answered, being able to communicate during the sessions, things that worked, things that didn't. So with that, let me start with, first on the agenda is COVID-19. So we are, 9 or 10 months in now, and it has no end in sight at all. The feds are working virtually from our homes. Some of you are able to go into your agencies. And of course, those who work with the young people get to see them. If you have a very brief update to tell us about what you have found, either what your agency is doing that's either really successful or has been very problematic during these times, please enter that or raise your hand to talk, but it has to be really brief because there are a lot of us. Mainly though, we really want to thank you, the agencies, the grantees, for the work that you've done in keeping the youth and your staff safe and your communities. There have been so few reports of either youth or staff who have tested positive, and that is such a tribute to the work that you do. So with that, I think I don't see anyone who wants to talk right now about their experiences with COVID-19. If you want to add something in the chat box, of course, feel free. So that brings us to Patrina and Angelica. Do you have anything you want to add on a COVID-19 update?
No, thank you, Deb. And in terms of hearing from you all, we've, Deb and Patrina had the California call last month. I had the call with the ones, for those of you that I work with, and there's lots of updates that you provided. So anything, whether it be the challenges, the common challenges that you're still seeing, I know there's a resurgence in a lot of areas. How is that impacting your youth? And or any sort of promising practices. There's virtual volunteering that I've heard of. There's you've been able to carry on life skills with youth. We've heard about a lot of counseling virtually. So we have Judith coming on. So anything that you would like to share, we would love to hear. So I'll bring Judith on here. Let's see. Judith, I just added you. Can you, if we don't see you on the screen, maybe you need to request to share your screen again, please. And thank you, Meg, for that update in the chat, as well as Grisel. Okay, Thomas, thank you. Screening the youth for COVID in advance before placement. Okay, so Judith might have jumped off. It seems like, okay, Judith, if you want to request your screen again, we can give you access.
Okay, got it this time. I wanted to say that one of the biggest challenges in my state has CARES Act funds out to the individuals and families that need them. We have a huge percentage of our CARES Act funds that was supposed to go for things like rent assistance and utility assistance that is still sitting in government hands because they are so paranoid that somebody might try to scam the system that they have made it almost impossible for anybody to actually complete the application process with all the documentation that's needed. And so we are looking at a whole lot of money that will probably be unspent at the end of December when it's desperately needed.
Thanks for sharing that,
I would
Judith.
also say that January is when our nonprofit agencies are expecting the big hits to come on their state and county contracts that help to support the RHY programs. During the last few months, agencies have managed to get the paycheck protection loans and, of course, the CARES Act funds that went directly to the RHY programs have been very helpful in tiding them over. But I think January is where we're going to see the real desperation coming for funding for health and human services.
Thank you, Judith.
If anyone else wants to come on, that would be lovely, but if not, you may enter your thoughts or updates in the chat. And I think that we will now continue to RHY. Oh, wait, you got something
Yeah,
in there?
I'm just going to read what Amy is asking. Amy
Thank
from
you.
Housekeeping Shelter, excellent question. I'm wondering if anyone has found successful ways to adapt your outreach in light of COVID-19. We're using social media, but continue to be challenged to reach youth who need support. Yes, Amy, I've heard that from many agencies. So if any of you want to respond to that in terms of how you've adapted your outreach, that would be fabulous. And again, you can use the chat function or please request to share your audio and video to respond. Okay, so I'm going to bring on Anna Wilson here.
Hi there.
Hi there, Anna. Welcome.
Thanks. So what I think is interesting is that we, in terms of outreach, so we have a BCP grant, and in terms of outreach, I feel like since COVID started and quarantine and distance learning and all of that, the kids actually are doing more sharing with each other. And doing outreach to each other in these digital ways that are kind of mind-blowing to me. But I think like what we've seen, one of the biggest impacts to our community that we've seen in terms of quarantine for youth and social distance learning is that families are spending more time together than they usually would. And so lots of family conflict comes up and kids are running away more frequently in our community right now and ending up at the shelter. And so I think, yeah, for modifying outreach, I mean, we have done a bunch more social media stuff and set up, a Zoom channel and are trying to engage the community that way. But I gotta say, we owe like most of the amazing outreach that has been happening over the past chunk of months to the kids, because they're so resourceful. They've just figured out like how to show up for each other and share resources and information in ways that like the grown-ups in their lives, they're just like fumbling around in the dark trying to figure it out. So yeah, that's all. Thanks.
Great.
Anna, thank you for that insight. Yeah, connection doesn't stop, right? It takes different forms and so forth. And thank you for all that. There's a lot of great information that folks have shared through the chat. So Amy, you have a few ideas there. And what I always tell grantees is that you're not alone. Whatever you're experiencing, there's another agency or a few dozen that are experiencing the same issues. But definitely I'm seeing social media, sharing information through the agency website, a lot of phone calls, reaching out to churches and rescue missions. And some folks have continued with outreach just using PPE, or perhaps you're putting hygiene kits out at a table and not and keeping that observing that social distancing and mask wearing and so forth. And we've heard about reductions in youth that are coming into drop-in centers or to that are seeking BCP services. Okay. In nice weather areas, thankfully in Las Vegas, this is the perfect time to be doing outdoor outreach, and you can set up outdoor areas where you're able to provide some of those gateway services and so forth. And bringing on Sparky here. Okay, let's see. Sparky, I just added you. If you see that blue button at the top of your screen, can you click that again, please? Somehow it didn't bring you on. Oh, there we go. Great.
I couldn't get my screen on. Can you hear me?
We can hear you, yes.
Okay. I'll just add a little bit here. I guess you can just look at that one face. I was going to say, I think from March, we were trying to figure out how we were going to serve over 100 young people at our drop-in center and still keep everybody safe. We never did do any sheltering in place, including me and my admin staff. We've been in the office every day, just making sure we have the protection in place. And we have 250 employees, and we've not had any staff-to-staff transmission of COVID, but we have had COVID running pretty rampantly through a lot of our clients, especially the drop-in center. So one of the challenges we have faced is just when we've had to put people in quarantine due to exposure, and having to backfill with relief staff has made it really difficult. Our drop-in center is 24 hours. So I think that's been one of our biggest challenges, is just having enough staff to run the program when suddenly you're doing quarantine efforts. And I do want to say, come on, folks, stay home for Thanksgiving. Even when you tell people, stay home, don't travel out of state, I would say probably 10% or more of my staff's just going to go out of state and do Thanksgiving. And we've had this put in place. We can't quarantine them all, but we've told everybody, when you come back, you have to get a COVID test within 48 hours and stay home until at least the results come back negative. So I do think we've ended up having to compromise, because, we can be firm and say you can't do it, but when people say I'm going to do it anyway, it's compromise. So just adding that.
Thank you for adding that, Sparky, because Did I cut you off, Sparky?
No, my iPad dropped. Sorry.
Well, thank you for sharing that. And thank you for that last recommendation of everybody here, given that Thanksgiving will be happening next week. You really can't control where staff will be traveling to, seeing family or gatherings and so forth. So something to consider for just setting those expectations when they do return back to work, how you want to manage that uncertainty of where people have traveled and been. Great information.
Yeah, I think at this time we need to move on. I want to note that we have put a poll up in terms of the December bi-monthly call. So if you get a chance to go to that poll and answer, we'd be grateful. And now I think it's time to move on to RHY. You're on mute.
Okay, can you hear me now? Okay, so as you all know, the deadline for the RHY was midnight Eastern Daylight Standard Time on Monday, November 16th. And we know that a few of you was unsuccessful for a number of reasons. And we're hoping that maybe at the end of this segment that you'll be able to share some of your experiences. But what I'd like to inform you, and this is probably what most of you already know, but as a reminder, if your upload was not successful, well, if it wasn't accepted or completed on time, and if you haven't done so already, you must email your federal project officer explaining what happened and contact the RHY help desk. And I will put that email address up there for you and explain to them what happened. The service desk should contact you and help you to resolve whatever issue you had, whatever error message that you was dealing with. They should be able to, you should be able to go to them for assistance, and they'll kind of walk you through it with the hopes that your next upload will be successful. And if you haven't used the service desk before, you'll need to create a username and a password for the first time that you used it. Okay. Also, I'd like to provide you with the direct number to the RHY customer support number, support center. I'm sorry, the RHY customer support service number, and that number is, and I'll put that also in the chat when we're done, 1-800-883-3179. And that is the RHY customer service number, or RHY-HMIS customer service support number. Okay. And as most of you know, you must upload your data. It's being twice a year using the RHY HMIS repository, and that's during the spring and the fall. But because of this year we only had one upload, and that was the fall. And that's because we replaced the old RHY point data system, portal system. And so we're only going to have one for the fall. But from what I understand during the federal session yesterday, we won in the spring. Okay. And you may even be able to, if you can correct your data, upload the new data. Okay, so I'm going to enter that information in the box in our chat feature. And if you have any questions or you'd like to talk to us a little bit about your experience, please feel free to do so now.
And Katrina, while you're typing that in, Judith, I see your question or the issue that you're experiencing.
Okay.
I'm not sure why that happens, because we get it as well. Us FPOs, even though we don't use a repository to enter data, it seems to come very often. So I've jotted down your question, and I'll check with the help desk to see if this is the case all the time. It seems like those passwords expire very quickly. So I thought it was only us, but it seems like you're experiencing that too. So thanks for stating that.
Okay. And are there any other questions or concerns, or just information that you'd like to share regarding your experience using the RHY HMIS repository upload?
Katrina, what is that number again? I can type it in.
Yeah, I'm putting it.
Great.
I've had a little. Hold on here.
And thank you for bearing with us. When you've reached out asking questions, we wish we could help. We just don't have all the technical expertise to support some of those questions and issues that are happening with the RHY HMIS repository. So your best bet is to reach out to the service desk and get assistance directly.
Oh, wonderful.
Great,
Okay.
Norma, that's great.
Yes, I'm happy to hear that. Operation Safe House. Wonderful.
And James, that's great. That's a pleasant surprise. Felt the overall upload feeling easier. And I'm going to bring on Brenda from Park County, Las Vegas. Hi, Brenda. Good to see you.
Hi, Brenda.
I just wanted to give a shout out to our two partners, NPHY and Help with Southern Nevada. So I was in charge of the RHYMIS upload, and because they had done such a great job of entering everything into HMIS, all I had to do was pull a report, upload it to the RHYMIS, and it was beautiful. So shout out to our two partners for their great work. It made our RHY upload very easy.
That's great. Okay, good to hear. Success story. Great. Good to see you as well, Brenda.
Me too.
And I know there hasn't been success stories all around. We get it. There's been a lot of challenges with it going from the old system to a new system. So hopefully by the spring, things will be a bit more streamlined, and you've identified those issues now that will hopefully make it a bit more seamless for the next upload.
And another thing that I'd like to stress is you have 3 weeks to do your upload. It's very important that you do not wait until the last minute. Please do not wait until the week of. It's important that you start your upload as soon as you can. That way you could address any of the issues that you have or problems that come about, and you don't have to pretty much worry about meeting the deadline if you start early, right? Because you can upload your data, send it, and if there's a problem, you contact the help desk, they'll walk you through it, and you send it again. And so you'll still meet the deadline. So it's very important that you do it early.
Great. Should we move on to supplements?
Yes.
Yeah.
Okay.
Thank you,
Great.
Bridget Alexander from Waking the Village, for your comment. I'm glad it was easier to read. Okay, good.
Good.
And you were able to correct some of the issues and reload it. Wonderful. Thanks for sharing.
And yes, please feel free to keep using the chat even for shout outs and appreciation. That's great. I'm moving on to the supplemental funding, the CARES Act supplemental funding. There's nothing that should be new here. For those of you that are brand new grantees, this does not apply to you because you didn't have an award when that CARES Act supplement was awarded earlier this year in response to COVID. But for the rest of you, the majority of you, you should have been receiving email communications from us, Deb, Katrina, and I, as well as during our calls, just to remind you, if you have not spent those CARES Act funds, if you haven't done so already, please reach out to your FPO so you know who you need to reach out to so that you can get guidance on submitting that carryover request. The carryovers are for those grantees that have a continuing grant. So that means that your grant didn't end this year. For a small portion of you that where your grant ended September of 2020 and you still had unspent funds, you would be requesting a no-cost extension. These should have already been submitted. However, if you have not, it's okay. We recommend that you submit them as soon as possible, but just make sure that you're asking your finance folks if those funds have been spent. For those of you that might have attended a session on Monday, the new grantee orientation, Katrina Morgan from our Office of Grants Management mentioned that if you have not received your new notice of award within 30 days of having submitted that carryover request or no cost extension, please do reach out to us, reach out to your grant management specialist. I'll go over that in just a little bit later because there were a few changes with your grant management specialist. Reach out to us to just get a status update. The Office of Grants Management, which is based in DC, they're not here in our office. They're trying to process those as quickly as possible, but they do run into snags. There is a large volume of carryovers that they have to process this year. So please bear with us. But again, if you're not hearing back within 30 days, do reach out so we can see where your carryover or no cost extension, where it is in the process. But anything else, Deborah, Katrina, regarding that supplemental funding and requesting those carryovers and no cost extensions? Patrick, your question, will we get a notification that our carryover was approved? The way you find out if that carryover is approved or when it is approved, you or whoever has access to Grant Solutions, you should be getting an email notification from Grant Solutions stating that you have a new NGA or Notice of Grant Award in your Grant Solutions file, and that should indicate that that carryover was approved.
And next, I want to go to the virtual site monitoring visits. That was discussed on the federal update yesterday, but I just want to tell you how it's going to immediately impact you. Many of you would have been receiving in-person visits now and through all of 2021 calendar year. Now it appears that that is not going to happen. There are going to be pilot virtual site visits conducted in several places, one in the state of Washington, one in the Atlanta region, and one somewhere else. Anyway, it's not region 9, but those will be the pilots. Then in January, there is one agency that will be also a pilot for a virtual site visit. Most of this will be done via Zoom, but many of the information will be requested in advance. So that will be with Mendocino County Youth Project. The central office requested that it would be an agency that only has basic center. So a lot of agencies were eliminated just because they have more than one grant. So that is going to be happening. And then starting in February, we will be doing virtual site visits. Many of you, even though it's mandatory that site visits be conducted once every 3 years, we don't always get to do that due to both logistic and financial reasons. We run out of money, we don't have enough people, etc. But we will be trying to do that. And we certainly look forward to working with you on that. Does anyone have questions or comments about the virtual peer monitoring visits which will be occurring? Okay. In that case, I think we'll move on to a summary of some of the important aspects of the federal update yesterday by Angelica.
Great, thank you, Deb. As you remember from yesterday's session, there was a lot of information shared regarding RHY, HMIS, as well as some of the 2018 upload data that Risa Matthews went over. Some of the information that Katrina shared was also shared yesterday. Let's see here. I'll go into, if you all remember, the awards in 2021. So many of you may be looking forward to what funding opportunity announcements will be available this coming year. So we do anticipate, and this is all a forecast, things can change, but so far, Street Outreach Program and Basic Center Program are generally staying the same, no huge changes. For Street Outreach Program, it'll be an anticipated $150,000 per year for the maximum award. For Basic Center Program, $200,000 per year, which has been the case for the past few years. So no huge changes there. A few changes here. So as many of you remember, for this 2020 fiscal year, there was no TLP or MGH FOA that was released. It is anticipated that next year in 2021, those two funding announcements will be released, and they will be separate ones. So there will be one for Transitional Living Program or TLP, and another one for Maternity Group Home or MGH. Another change is that for the past few funding cycles for the TLP and MGH, they were 3-year grants, like the Street Outreach Program and BCP. Those are 3-year grants. The only ones that are anticipated to be 5-year grants will be that TLP and the MGH program, with maximum awards of up to $250,000. So again, that's the major change. The TLP MGH will be up to $250,000 with a 5-year grant period. I'll pause there to see if there's any questions. And then do this really quick. The monthly calls with Federal, yes, the monthly calls with me have been via call. We can totally do a video call. I would be more than happy to do that. Yeah, so Brenda, for $250,000 per year. So those numbers that I mentioned, so $150K for SOP, $200 for BCP, and then the $250,000 for TLP and MGH, that would be per year. And then yes, for TLP and MGH, it would be for 5 years. Yes, Gina. I should have clarified that, but thank you for asking. And again, this is a forecast, things can change, but it seems like typically things do kind of continue what is stated in the forecast, I think. But yeah, if there's any questions regarding that, please ask away in the chat. We'll try to catch those questions as they come about. If you think of any questions afterwards, reach us via email. This wasn't, I don't believe this was shared during the general federal session yesterday. It was shared on, probably wasn't even shared on Monday, but there are new grant management specialists. So again, you hear us three on this call, we're your main point of contact for programmatic, programmatic issues, questions, and so forth. Your Office of Grants Management or Grant Management Specialist, as we refer them to, they're based in DC, and they're the ones that take care of the issuing of the Notice of Grant Award. They help provide guidance regarding the budget and the finances and so forth. So there have been changes for the state of California and for the state of Arizona. And I'm going to put this information in the chat. But there are new grant management specialists, again, for California, and Arizona. And for those that have access to grant solutions, you should have received, oh, okay. Sorry, so I'm just, it looks all jumbled in the text. Copy and paste it. We'll send an email afterwards. It's gonna take me too long to space it out neatly. But you can see here, no change for American Samoa, Guam, Hawaii, and Nevada. You still have Sonia Richardson. There is a change for California. Let me see if I can make this neater. A change for California. You will now be interacting with Teresa Hall. And let's see here. Nope, it's still, sorry about that. Just bear with that. Just you can make your own spaces there. So California, Teresa Hall, you'll see her contact information there, as well as email and phone. And then for all of Arizona, you now will be working with Mark Hill. Any questions regarding that? Okay.
Angelica, so I wanted to mention, just to backtrack for one quick second regarding the TLP and MGH grants, that it was mentioned that the grants are going back to 5 years.
Right. Right.
So I think that's great news. Yeah,
Yes.
after this 3-year period ends, they'll go back to 5 years.
Exactly. Yes.
Mhm.
And the numbers that will be available, at least forecast now, did you say that yet, Angelica?
Oh, then like in terms of anticipated
How
awards?
many grants?
Oh, I could go through that. Yeah. So for street outreach, it is 34 awards are anticipated. For basic center program, 81 awards. For transitional living program, 48. And maternity group homes, 21 awards.
Thank you.
Yeah, great question, Deb. And Gina, does that mean that we will reapply? Will it be extended? That question was asked and it was addressed by Lisa Matthews yesterday. Unfortunately, if we do have a current 3-year grant that is a TLP or MGH that is ending, that grant will end and you will have to reapply. So there won't be an additional 2 years that would be added. This is the 5-year period is only for those new awards, for those that are successful. Yeah, thank you, Katrina. Yeah.
And then as our last item on our agenda, but by all means, if you have other things you wish to discuss, please feel free to add those. But what we would like to know is your responses to this virtual RHY training. We all know that, of course, we love being able to see one another in person, but we also know that it's wonderful that more people can participate. For instance, that Katrina and Angelica and I can all be part of this meeting, whereas before it's always just been one of us per region. So we wanted to know what your thoughts were on this. We have no way of knowing how next year will come to be and whether or not we'll be seeing one another in person or again virtually. So we want to know what you think about it. And also if you can say what you think might improve the experience, we'd be grateful. Thanks, Brenda. You like it? Cindy, you like the hop-in? I'm impressed. I had a heck of a time with it. Patrick.
Hi, can you hear me? So I had one thought on that, and then I have an additional question. I hope it's not inappropriate to kind of an unrelated question. So
Please.
One, I actually love it. I thought that this format was great for a conference. Whatever we're using, I forget the name of it, Hop In or whatever. And I also, like, a lot of my staff got the opportunity to attend some of the trainings that otherwise, I can only ever bring like one staff and one manager to a training. And it seems like it just saves so much money that can be used on other things, which I'm a fan of. So I don't know if I might be in a minority here, but I would actually prefer to keep it this way if all things were up to me. Although I do love seeing people, especially like at regional meetings and stuff. My question is sort of unrelated. With the new administration, do we have any anticipated, you may not know yet, but I'm wondering if there's any kind of anticipated changes as we get a new administrator. I assume we'll get a new administrator, right, in January. And for those of us who don't really remember or weren't as plugged in 4 years ago, like, what are usually the biggest changes that happen when a new administrator takes over FISB? And is there like going to be an opportunity for us to meet this new person, to do some advocacy directly from some of the programs? Just curious.
Patrick, it's something that we really should recommend because it's a great idea. It really is. The fact is that it could be done virtually per region, and I think that would be wonderful. we think that we don't know, of course, yet what will happen, what will transpire, but we're certainly hopeful that there will be some changes. But we will take that forward, the fact that you want to meet with the new political heads. That's a great idea.
So, thank you.
Judith? You're mute.
Just wanted to say that the organizers of this conference did a really great job in sustaining the interaction between the participants, which I've always felt was much more important than anything the speakers had to say. And it was a huge contrast to another federal grantee meeting that I went to earlier this year, where all we could basically do was sit and listen to speakers and ask them questions. And it didn't, the virtual networking sessions that we had at this conference were critically important.
Great.
Judith, really quick before you jump off, did you attend the virtual networking sessions? How did that go?
I think they went really well, not quite as lively as when people can just talk freely face to face. But I thought the combination of, people using the chat intensively and some of us getting on live like I am right now worked as well as you possibly could in a virtual format.
Okay, thank you. Thanks for that feedback. I'm hearing comments in the chat about you liked Hopin. Nicole saying about a hybrid. So, there's people that can attend in person, but not everybody can. So would that be an option? Possibilities are open right now, given that we were kind of forced into this virtual option this year. So at least we know what works. Networking sessions were great. Okay.
I do miss being able to go to lunch or dinner with people who have interesting things to say.
Exactly. Yes.
Thank you.
Okay. Kayla, could the expo reception have specific rooms for different regions? Yeah. Okay. And all this, we're going to get a transcript of the chat, Deb, Katrina, and I, so that we can go back and pull out those suggestions and recommendations that you have. Great, Brenda, you were able to reallocate your travel money to youth-focused budget line item.
For all of you, if you can remember, if you haven't gone to the poll yet to respond, at the moment, the way it is, California would prefer to have a group call in December rather than the individual calls. And we will follow up with our boss, with Jeff Daniels, to make sure that that's acceptable to central office. He'll have to ask them. But I mean, we certainly look forward to those group calls. So they're full of energy. So that sounds like fun. And if the other states would prefer to stay within themselves with Angelica, so that's fine too. But if you haven't answered the polls, please feel free to do so.
Zanetta, your question regarding your new regional family information. So like a contact information of your regional colleagues, is that what you were referring to? Okay. Deb and Katrina, I know we've done that in the past, where I think last year we did share an attendee list. Is that something that we could do?
I don't know if Youth Collaboratory has made any sort of a list. We can certainly ask them. I think that with, I don't know, 1,600, 1,700 people who have registered. I don't know if it's doable or if it has occurred, but we'll look into it.
Yeah, or perhaps even just the Region 9 list so that folks can keep continuing. We can share names and emails. Unless somebody opposes, you can let us know, but we can definitely share this name and email from agency, and you can reach out to one another. Zanetta will work on that. Okay. Oh, and Joy, thank you. Thanks so much for that as well. Yeah, there's a lot of connections to be made even across the country. So thanks for checking on that. And yeah, Zanetta mentioned we will work on the list, and Joy is checking to see about registrant list for the entire conference so that you can connect with one another. Go ahead, Deb.
It appears that we're almost at the end and we don't have anything more coming in. Yeah. So we're going to leave it open. We have 7 minutes left. We're going to leave it open so anybody who wants to hop on or put something in the chat may do so, and we'll still be here. So feel free.
Yeah. And also, while we're waiting for folks to either jump on or provide, I provided this update to my regional colleagues, but just want to let you know that I'm expecting my first baby. So I am.
Congratulations.
Thanks. So for the California grantees, so I just just wanted to share that. So I'll be out for a little while towards the beginning of the year. And Deb and Katrina, thank you in advance for covering for me, but I'll be sharing with the grantees that I work with on who you'll be reaching out to, just so there's that continuity and coverage. So. Thank you, everyone. Thank you. Okay, Patrick.
Hi. Sorry, I had one more thought just about the regional meetings. Would it be? I think it'd be really cool and useful, especially since we didn't have the chance to meet in person, to maybe even have like a more micro group meeting. So like, very selfishly thinking of the Bay Area, it would be nice to get together with like Bill Wilson and North South and Dreamcatchers and Diamond and Larkin and all of the kind of Bay Area programs just to talk about trends and things that are happening a little like more micro locally. And I don't know if like the LA folks or the Central Valley folks and other folks might enjoy that sort of micro region as well.
Katrina, you're on mute.
Oh, I just said that's a great idea.
Yeah, and we can actually, it's too late to do it as a poll on this platform, but we can send out a message to, at least to the California grantees, asking them if they want to at some point do those sort of micro meetings, splitting up the state into various places or issues. And the other thing to remember, and Katrina and I have not been doing it, I don't know if Angelica, if you have, we are expected at some point in our bi-monthly meetings to include a fiscal person from each agency in a call. So I just want you to know that that is going to be happening. maybe January,
And yeah, with
February.
yeah, thank you, Deb. With those, I'm seeing a lot of Arizona love here. So that's great. If at any point, for example, the Arizona grantees would like to have a separate call, and I could either facilitate or at least set up the platform and you all meet,
Yeah,
that sort of thing. I can help facilitate that with the California grantees, even though we couldn't do it here at the conference. If it's something that you all want to make happen in the future, we're open to that for sure. Because so far our group calls have been all California with Deb and Katrina, and then the rest, the non-California grantees with me. But we can do a breakout for various subgroups. And Zanetta, yeah, getting a group of the Arizona emails, and I can do that. I can send out the emails for Arizona so that you all can connect with one another. Especially as a new grantee. So Zanetta's with Lifology in Phoenix, Arizona, and they're great at networking, and they've been absorbing so much information since they've been awarded this past September. So it's definitely helpful to connect. But if anybody else wants to speak, we have a few more minutes. Okay, a meeting for street outreach grantees that have drop-in centers. Okay, right? Yeah.
you've started something here, Patrick.
Yeah. Micro meetings.
It's true that in addition to not seeing one another at the national training, we also missed the regional training, which would have been held in May. And we were really looking forward to it, but.
Yeah. And then also, I know earlier I mentioned that, we can help facilitate some of that. You, of course, don't have to wait for us if this is something that, somebody wants to organize, once you have that contact information amongst each other, please feel free to run with it. Again, we're happy to support the planning of that. I know the logistics is sometimes a little bit of a roadblock because we understand you're all very busy. But definitely don't have to wait for us to have any of these smaller meetings, but just reach out if we can support. Cheyenne, will there be a virtual regional meeting in May? We have no idea at this point.
It's highly unlikely.
Thank you, Regina.
And thank you, Joy, for helping us.
Yes. And Joy is on. She's with RHY. Then we have Barry with Catapult, who has been tremendous in helping us make sure that this is a seamless platform for us for this session. And please do fill out the evaluation with that link that Joy just entered in the chat.